Welcome to Be Time, everybody. I'm Beth Bierbauer, healthcare executive, author, and host of this podcast. Be Time is a podcast for individuals who want to invest in themselves and their careers through continuous learning. Each week on Be Time, I have the honor of interviewing a seasoned executive, company founder, or other industry expert, and we talk about a variety of business topics. So whether you're inside the healthcare industry or out with a large company or small, Be Time has something for you to help you stay on top of your game. So let's get started. I think we all know the Medicare Advantage market is hot and there are new entrants every year. There's one company that we're going to talk to today that really is trying to make its mark and try to take share from the national health plans by offering a very customer-centric and simplified experience. They are called Troy Medicare, and if you go to their website, their tagline is health insurance, no BS. That is an intriguing proposition, and I want to learn more from our guests to see exactly how they are delivering on this proposition. With us today is Flaviu Simihaian, who is the co-founder and CEO of Troy Medicare, which is a Medicare Advantage plan founded in 2019 in North Carolina, and they have plans for expansion. He is a repeat entrepreneur where he developed imedicare, a platform for helping pharmacists manage patient care. I am really excited to learn about what they are doing to change the game for individual Medicare Advantage plans. Please join me in welcoming Flaviu to the Be Time podcast. Flaviu, welcome to Be Time.
Glad to be here.
Well, we are really, really happy to have you here. Why don't we start with the founder's story? What was the impetus? What was the drive behind you starting Troy Medicare?
Gosh, it's like Troy Medicare seems like a overnight success, but it was 12 years in the making. The impetus behind Troy is pretty simple. Look, as we age, we have more and more healthcare needs, and the current system that we have in this country that's supposed to be addressed those healthcare needs is shameful, to be honest with you, right? The most vulnerable people in our country have to navigate the most complex web of middlemen just to get a cane or fill a prescription or see their specialist. And so that's, we often talk about us being no BS, and our mission is to remove the BS in healthcare. That's what we're talking about. If you get discharged from a hospital today, you'll have dozens of papers you don't understand, people calling you from different companies with different incentives about filling different prescriptions at different pharmacies. It's just a mess. So that's just not okay. And I think it's our job, it's our duty as the slightly younger working generation to make the system simpler for those who need it the most. So that's what we started this. I can certainly go into my background on how we got here, but that's what drives us every day.
Well, let's talk a little bit about your background and how we got here. So go ahead.
Sure. Look, I was born in Romania. I grew up in North Carolina, just north of Charlotte in Concord, and went to school there, went to college there, and kind of got to see and live and breathe small town America for most of my life. And after college, I started a company called imedicare with a friend who's a pharmacist. And it just blew my mind at the power of that pharmacy for each of these communities. I knew it growing up, but then it just is incredible to see across the entire country how valuable that local touch point is for particularly seniors that visit pharmacies, and particularly independent pharmacies that provide a much higher touch, personalized care that honestly, CVS and Walmart just can't provide that level of high touch. So we grew this business, imedicare, fortunately, to over 10,000 independent pharmacies to use a software platform that helps them streamline their workflow, help seniors save money on prescriptions by finding more cost-effective Medicare plans to cover those prescriptions. And we've helped, I think, about 3 million seniors save billions of dollars on their prescriptions by finding a better Medicare plan. We eventually sold that company and just felt that look, we've helped folks, like I just mentioned, save that money, but just it didn't really feel like we changed the system, right? They were on Cigna now instead of Aetna, but fundamentally, the problems were still there. They kind of honestly hated both plans. It was just choosing the lesser of the evils. And of course, the pharmacy hated them because most plans are now owned by their competitor, right? CVS bought Aetna, and Express Scripts merged with Cigna, and Humana's partnered up with Walmart, and United's got Optum and Walgreens as a partnership. Whereas my people, the independents that I was trying to help and their patients, they have nobody. In fact, everybody's actively trying to put them out of business by switching the seniors' prescriptions, to their chagrin, to mail order or to a chain that they own. And that's just not okay, because the senior, like we were just talking about, they get better care. They want to go to the independent, and these plans won't let them. So that's why we started Troy. They said, you know what? I think we could do better. I think we can build a better plan for that population, their pharmacy, their providers, to get out of the way as a plan and enable that local provider to do their best without the hassles and the pains and the BS of health insurance. So that's how we started Troy, and it was crazy. Everybody thought it was stupid and there's no way it's going to work. But here we are a few years later, still alive, still kicking and growing.
Yeah, that's for sure. That's for sure. Now, I've heard this many times over the years, that people actually see their pharmacist more frequently than their doctor. Is that true, or is that just maybe an old wives' tale?
Yeah, that's absolutely true. Look, our average senior sees their pharmacist 3 times a month. 3 times a month, right? That's 36 times a year they see this clinician, this doctor of pharmacy. Whereas they might see their PCP, twice a year, 3 times a year, right? So order of magnitude more than they get to see their physician. And so that's just incredible that we have these touch points between seniors and clinicians, yet we waste them, honestly, in a lot of ways now, right? We're like, oh, why don't you just count pills, put them in the bottle, off you go. Well, wait a second, that's an opportunity to engage with that person about much more than just the prescriptions. And honestly, pharmacists have constantly been telling people, like, hey, we can do this. We know more about the patient than these other people. And yet most plans are like, just shut up and fill prescriptions. And honestly, just switch the prescriptions over to us because we can fill them faster and better. So they've been ignored by the entire healthcare industry for decades.
I think you're really on to something. Oftentimes, whether it's a health plan or a large company, looks at the efficiency that you get through mail order. But what they miss is the fact that, number one, elderly people like the social interaction. It's why they like to go to the pharmacy. And number two, they feel somehow more comfortable with the pharmacist. They don't want to bother the doctor, but they feel comfortable talking to the pharmacist about their issue and asking questions. Somehow the pharmacist is much more approachable to the average consumer. And I think if you miss that, you miss that opportunity to really, engage Mrs. Smith about her diabetes, right? Or is she doing her nebulizer treatments? Is she, you've noticed she hasn't refilled a prescription. So I really think you're on to something there, because that's a key insight. It isn't about efficiency necessarily and total cost savings for an elderly person. It's about that interaction. It's about having somebody I trust that I can talk to, but not feel like I'm bothering my doctor.
You're so right. We have this notion in healthcare that drugs are separate from health, right? There's Part D drugs, and then there's Part C for health. And pharmacists, they know medications, and doctors know health. But it's just ludicrous, because drugs are inextricably tied to our health, right? In fact, non-adherence is the most common reason people end up in the emergency room. So I mean, we see it all the time. Patients often don't know how to use their inhaler, right? So you have COPD, and pharmacists teach them on how to use it. Pharmacists can measure blood pressure and weight and blood glucose and help fill HEDIS and STARS measures for us as a plan. We have pharmacists that have smoking cessation programs. They have diabetes management programs. They obviously give vaccines. But most importantly, I think, and this is what a lot of folks miss, is they have data about a patient that nobody else has in healthcare. If someone is food insecure, someone's homeless, if their spouse died recently, that's just, like lack of transportation. They can't get to the doctor's office. United doesn't know that, right? Their mail order pharmacy doesn't know that. CVS doesn't know that. But pharmacists know this intuitively because of those frequent interactions that are high touch and the friendship, honestly, they've developed with these people. So that's the difference.
Right. And the things they know matter. It matters when somebody becomes a widow or a widower. Because when you're living alone and you're admitted to the hospital, you have a higher likelihood of a readmission living as a single individual. So let me ask you this question about why you named it Troy Medicare, and then we're going to dive deep into your business model. Why Troy Medicare?
Well, look, like I said, our mission is to remove the BS in healthcare. So we're like the city of Troy, taking on the big Greeks, the other big payers that we're fighting against, and the odds are against us. But we're nimble, like David against Goliath, and with some luck, hopefully we'll topple the giants. So look, most plans, kind of have this approach of verticalizing healthcare, right? By owning the full stack, owning the doctors, the nurses, the pharmacy, the plan, even some facilities. And by having that whole stack, you can keep you in their walled garden where you go through the plan or its subsidiaries for everything. And the question is that what's best for the patient? We at Troy believe it's not. It's not what the patients want, right? Instead, we feel our job as a plan is to get out of the way, and not be everything to everybody. Instead, empower the local provider, the local pharmacy that knows patients best, and leverage those interactions in a high-touch way that are much more effective than some big box healthcare giant like United ever could. So that's how we feel that we're kind of like the Trojan warriors.
That's a great analogy. So let's talk a little bit about what the pharmacists actually do. Of course, what immediately comes to my mind is medication reconciliation, medication adherence. Are they doing chronic disease management? Are they doing care management? What other things are your independent pharmacists able to do under your program that maybe we wouldn't typically see under a traditional health plan?
Oh, absolutely. We are, I think we're the first plan to incentivize pharmacies to go well beyond the medications. For every Troy member, one of the pharmacies in our network have to fill out a care plan. So a full care plan that includes medications, but also includes their blood pressure reading, their weight, right, BMI. We have a program for continuous glucose monitoring where we actually have a $0 copay for Freestyle Libre. Actually, I was wearing it earlier to have continuous glucose monitor readings for patients. They counsel them, like I mentioned, on smoke cessation, diabetes management, even diet. So it goes so much beyond, and then we can capture that data through our system. So we've built a technology that gives pharmacies the data, first of all. And for instance, when a Troy member gets out of the hospital, we're the first plan to notify their pharmacist. Like nobody's ever thought of that the pharmacy should even know or care that their patient, who they've been known for 30 years and they see them every week, nobody's ever thought that, like, oh, we should tell them that Mrs. Smith was in the hospital, right? And so we tell them that, say, hey, she just got out of the hospital and we need you to go over to her house, do one of these care plans. She's going to need a shower chair, a bedside commode, if you can help, because a lot of the independents actually stock durable medical equipment. So they actually can take that off their shelf, go over to their house, install it, make sure it's a safe environment for him, really address the social deterrents of health that other plans, kind of dream of doing, because this person that's known them their whole life is in their home, making sure things are safe. There's no uneven spots in the floor, checking if they have a refrigerator that works to keep their insulin. These are all things that independents do, and we reimburse them for doing them and documenting what they've done.
Fantastic. Now, you mentioned something around prior auths and things like that. Do you have the ability, since these are pharmacists, to eliminate things like prior authorization for certain medications or step therapy? Do you empower the pharmacist to just say, nope, your decision, you go with it?
Exactly. We've been able to remove so much BS on the pharmacy side, from the step therapy, prior authorizations for drugs, as well as introducing generics on the formulary. For example, just the other day, this happened in that we looked at our formulary and said, gosh, we have Lantus on the formulary. And it just occurred, look, we have pharmacists. My co-founder's a pharmacist. I said, look, isn't there a generic for Lantus by now? So we look up and it's like, look, there actually is a generic for Lantus, Semglee, that has been on the market for 2 years. And it's like, that's crazy. How do we, as pharmacists, don't even know that this drug exists? And so we look at all the formularies for the other insurance plans and our own, and sure enough, Semglee's not there. It's literally not available, covered by any insurance plan we could find, even though it's a generic for Lantus. We complain about insulin being so high, such a high cost, and yet here is a generic that's 4 times cheaper, and no insurance company will put it on their formulary.
Is that because of rebates? Because they're getting rebates back on the other ones, likely?
Yeah, so we tell our PBMs, like, look, we need to add Semglee to the formula. They're like, well, Sanofi, hopefully Sanofi's not listening to this podcast. Sanofi's going to get upset that we have a generic. Well, it's 4 times cheaper. There's no way the rebates can be, 75% of the drug cost. And even if there is, it's the right thing to do. So what, screw it. We'll take the hit. We rather have a cheaper insulin on our formulary than not. So after several weeks of fighting that battle, Semglee's now on the Troy formulary. And honestly, I just kind of urge other plans to do the same, because I think plans don't even realize that drug exists and the PBM's keeping it off the formulary. You know what I mean? It's crazy that's even happening. But I think plans need to step up their pharmacy game and say, hey, we need to take control of this and make it more transparent.
Right. Well, and part of that is the rebate game, because some people will get the heavy rebates. So on the back end, it all works out. But if you're paying co-insurance as a consumer, you absolutely want the thing that at cost is lower, so that benefits you from the consumer. Now, we talked very briefly about mail order. And the fact that, coming in is really a benefit, because now you can see these individuals in the pharmacy. But do you also offer mail order? And if so, is that a positive or negative impact to your model?
No, we don't. So mail order, I feel like is a sham. We don't. Mail order is not even an option on our plan, and the copays at a chain pharmacy are higher, and we incentivize that 30-day supply prescriptions in order to ensure that human touch, gets to happen at least once a month. 90-day supply from mail order leaves a tremendous amount of wasted, unused medications on a person's doorstep that the person either doesn't know how to take them, when to take them, or takes them inappropriately. And, it's crazy. On the plan side, mail order companies say, well, gosh, our adherence rates are so high. USPS delivered it, it's on the doorstep. But just because USPS delivered it doesn't mean the person took it.
Good point.
And when the average senior is on 6 medications, some of our patients, many as 20, with considerable side effects, that additional human touch is critical in order to make sure they are educated on what to take, when, and how. Strip packaging, like all of our pharmacies do, that's just critical. I'm personally only like 2 or 3 medications, and I honestly find a hard time timing it all and understanding it all. I can't imagine what it's be like to be 85, low income on 15 medications, just got out of the hospital, and then you get a box out of mail order like, hey, here's some drugs, figure it out. That's not healthcare. That's not, you know what I mean?
Right. And oftentimes when you talk to an elderly person, They say, are you taking your blood pressure medication? They say, well, I take the pink pill in the morning, and I take a green one and a yellow one at lunchtime, and then I take a blue one in the evening, right? And that's how they really kind of think about it. So to have somebody that can really help them through that is critical. Now, you did something on product that I just love. Steve Jobs would love you for what you have done on product. You offer, listen to this, if you're with another health plan, one product, and that product is zero premium, zero copays for generics. I think this is brilliant. Share your thinking behind that one product.
Well, thank you. I appreciate you saying that. I think we have a long way to go before before we're at the Steve Jobs Apple level, but certainly trying to make it easier. Here's the thing: it's offensive to us that Blue Cross has got 5 different plans that are all named almost the same thing, and they confuse serious
Gold,
seniors.
gold plus, silver.
Exactly, and it goes back to, again, putting the folks who are in the hardest position to decide between things that are almost purposely confusing. And like, for instance, in the place of Blue Cross, you got 5 different plans ranging from premium from $0 to $80 a month. It's a huge difference in premium. And believe it or not, the $80 a month one has worse benefits than one that's $0 a month. And that's wrong. It's so complicated that seniors end up signing up for plans that cost them more and get fewer benefits. And that's just the BS that we're trying to remove from healthcare. So it was just critical for us we're not in this to trick people, to use brokers to trick people into signing up for the more expensive plan, because that's where we make more money. It's just not right, And we're adding to those benefits. This year will be the first plan to offer a phone and internet benefit to seniors, because so many of our low income seniors don't have access to a phone or internet on a reliable basis, believe it or not. And that's just, honestly, we think that's a social determinant of health right there. If you can't even get in touch with a senior about their medical necessities, how are you going to have an impact on them? So we've added that, and we're going to continue to push the envelope on those type of benefits that make our plan simpler for people.
That's amazing. That's really, really terrific. Now, we talked about removal of step therapy and prior authorization for pharmacy benefits. Do you still have some of the similar workflows and processes that a health plan has around prior authorizations for hospitals, and you pay claims and you worry about stars and HEDIS and things like that?
Yeah, look, that's kind of the part for the course to be a Medicare Advantage plan, is to do all those things. And some we do in-house, like the provider contracting and relationships. We want to keep that close in-house. Some, like the third-party administrator, claims processing, we use a company called Tabula Rasa to do. And stars has become increasingly important. We're actually right now in the process of hiring what we call a stars czar, as we begin our measurement period next year for reporting stars in 2023. So we're still early, but that's where we're heading.
Okay. And when I think about competing with a larger health plan, typically they have really broad networks with deeper discounts. So how do you compete? Do you have a narrow network with hospitals and providers? How does it look from that perspective?
That's a good question, because we approach provider and say, look, we're going to pay you fairly at Medicare rates without the hassle of the big plans. And many providers really appreciate this and are eager to join the network and kind of have an alternative to the big plans that have been kind of jerking them around for decades. And so while we may pay more than United, because United will end up wanting to pay 90% of Medicare rates, we save money by the decreased overhead and bureaucracy involved with administering a very complex agreement with all the gotchas in the contract that trick providers into getting paid less. So again, it kind of goes back to our core value of being fair and transparent, and we think that extends to providers. And if we do right by them, they'll do right by the patients. And just by making things simpler, it should save us a bunch of cost and hopefully the provider eventually. So much of the increase in health costs is just adding billing vendors, billing contractors to help them just to figure out how to bill United. And then United's got, billers on their side trying to like work the opposite. It's like, it's crazy. Why can't we just Medicare already set the rates and the rules? Why can't we go off of that and make it easier?
You are really onto something there. You've said it several times now, how simplicity is really critical in lowering costs. When you look at healthcare systems throughout the world, many other healthcare systems that are lower in cost are lower in cost because they don't have the complexity. They basically pay whatever the provider submits a bill for. But it's not just an honor system, right? They certainly look for broad abuse and things like that, but they don't have all these pre-certification requirements. The providers know what's covered, what's not covered, and that administrative efficiency is just, through the roof. So costs are really lower. So you have simple plan designs, simple provider contracts. That really adds up because then you don't need all the people, all the complexity, all the systems. So really, really good for you. I like the way you're thinking about that.
That's exactly right. And that's how we've been able to get so far with significantly less capital than you see other plans as well. And we think at scale, that's really going to translate into better results. Honestly, we should be a pass-through entity with as little overhead as possible. Like you see Stripe, for instance, on the payments fintech side, it used to be that taking the credit card require a tremendous amount of third parties and processors and people to check, and now it's a line of code and boom, it's done. Now we can take payments and get them immediately. That's what we should. That's what, if we succeed, Troy should be sort of in the background, empowering that local provider and the patient with data for them to get care, but not slow it down by adding stoplights at every turn. It's like, oh well, now you got to call us. And then we're going to make calling us, a 1 week process to give you an authorization for a service that you're going to, end up doing anyway. So it's just not, that's just where we're going.
Well, based upon everything you told me, your members must love you. Do you have a net promoter score or anything, CAPS information that you're able to share with us?
Look, we're still early. Look, we captured net promoter score and we're in the upper 60s, but I'd caveat that to say we're still at 1,000 members. We're growing. CAPS will start next year for us from CMS. So I think as we continue growing at 3,000 plus members next year, 10 to 15,000 the year after that, these results will be more statistically significant. So honestly, we're not the best at being out there pumping our chest about what we're doing. I think for us, like the proof is in the results. So we're just out there. I think we'll show the model works as we grow to 10,000, 20, 100,000 lives. And I also want to show CMS and legislators too that, hey, you can build a plan that doesn't have, rebates and DIR fees and all these back payments from one party to the other. You can build a plan that's only one, that's zero premium. You don't have to have five that are all confusing for seniors. And I guess our hope is that by proving that, eventually CMS will say, well, gosh, Blue Cross, why don't you have a plan in the same way, right? Like CVS, why don't you pass through all the rebates and have no DIR fees? And that would be kind of success when the market changes to be more transparent.
For sure. Well, you are definitely a pioneer in this area, and we need pioneers in this area. So congratulations on everything you're doing. Now, we like to learn from our guests what books have inspired them or they maybe are currently listening to, and what might be on their podcast playlist. Anything to share?
Yeah, so a couple of things on the podcast healthcare side. I love the Tradeoffs podcast. It's a really amazing podcast that they constantly talk about some of the challenging issues in healthcare and how there's trade-offs to be made. And another one I really love is Peter Attia has a podcast named Drive, and that's about, he gets into the science around longevity and improving the performance of our bodies. Really interesting. He's probably one of the pioneers doctors in the world, I'd say, right now. So that's on the podcast. On books, right now I'm reading this book called Doing Justice by Preet Bharara. He was a U.S. attorney for the Southern District of New York and talks about our justice system, and kind of he's just seen some crazy stuff in the past decade and a half. So I'm enjoying that.
Great. Well, anything else that you have that you would like to share with our listeners? Any words of wisdom for them, whether from a startup perspective or just from a simplification perspective? Any other closing thoughts?
Look, I just say that I think we all stand on the shoulders of giants. I'm talking to you right now, but we couldn't have done this. We have, for instance, 170 investors that are pharmacy owners themselves in 38 different states. These are mom and pop owners, and without these folks believing that we can truly do better than the big plans, we honestly couldn't have gotten here. And it can be demoralizing some days going against these companies worth hundreds of billions of dollars, but we have a small and mighty team of Trojan warriors on our side that suit up every day to take on the challenge. So I really am thankful to them.
Well, I love it. I think what you're doing is really amazing. I think it's much needed in the industry, and it's just one step at a time, and you will absolutely continue to move forward. Just remain true to your roots and true to what your values are. So thank you so much for coming on the Be Time podcast and sharing the story about Troy Medicare. I'm really excited to watch you thrive and grow, and we will circle back with you maybe in a year or so and see where you are going.
Thank you for having me. Appreciate it.
All right. And to our listeners, that's it for another episode of Be Time. We will be back in a week. Thank you.